tabling this for him again?
If I can, this is the bill that limits the abortion place to within 2,000 foot of public or private schools.
This is the last one.
If there's no questions, I move that favorable report. Second.
Give a favorable report for Representative Patterson.
HB 527.
Seconded by Representative, was there some discussion?
Since Mr. Henry is not here, it may not be that important, so I would think so.
Well, Is that an official motion? So we have a move to table this bill by Representative Knight and a second by Representative Hall. If you move to table the bill, your vote would be aye. If you do not, your vote would be no.
Wait, but was there for Mr. Patterson, he moved to give a favorable report, correct? Or was there a second on that?
Yeah, I second.
And then, so we have two motions here at the same time.
And then the next one is
Next would be a substitute motion.
So,
and his second is the table motion?
Oh.
the adoption took place motion before the tabling motion.
So you do table motion.
Table motion first and then adoption. So if you want to table the bill, your vote would be aye. If you do not want to table the bill, your vote would be no. All in favor of tabling the bill, say by saying aye.
Aye.
Aye. Any opposed?
No.
Ayes have it. Now we are on the table report of the bill. We had a motion by Mr. Patterson, a second by Representative Nordgren. All in favor say aye.
I was going to, I have a comment before we vote.
Yes, sir.
I want to tell a true story, a live story about protesting at abortion clinic. My wife and I adopted a child, our daughter, 21 years ago in a private agency in Birmingham. They happened to have an abortion clinic right next door. We drove up that day to pick up our new daughter, and we had a niece, 2 small children in the car with us, or 1 small child in the car with us. And there was very heavily protesting the abortion clinic. I agreed with them. I did not like the way they handled themselves as well, because they literally were in the car almost. It scared the small child. That is not the environment that you want anyone to have to put up with, whether you agree with the way what they're saying or not. But in many cases, when you have that type of environment, it gets uncontrollable. That particular day, the child that was with us literally scared them big time. And I had to tell them, said, you need to get away. I agree with you that you need to keep your distance. But that type of environment should not be around school or anywhere else, period. Whether we agree with it or whether we don't, the way you handle yourself can get uncontrollable, and that day it was. 21 years ago.
Representative Hall.
I think what you missed is we started out with the idea that Mr. Henry was not here, and since Mr. Patterson was carrying it, that we would move the table. So the issue that we see happening on both sides of the confrontation, all those things, I understand that. I'm clear on that. But I do think those are choices that individuals make, and I'm not their God. So.
I did in response to that, and I clearly understand what you're saying, and that should not happen. That should not happen in any protest. However, on the same thing, I think that in this country, many people have protected our rights, and there are certain rights that we have that many of us don't like. But the First Amendment is extremely important, and I think should always be protected. Now, having said that, I do think that there should be some restrictions when it comes to things like what you're talking about. But to restrain the First Amendment, I think that it takes us back a long way from what we stand for and what we believe.
I have a motion on the floor for favorable report.
Madam Chair, just to accept responsibility for having not pointed out that Representative Henry had a conflicting meeting this morning. I knew that, and I should have said earlier when you mentioned to Representative Patterson, Ed was not able to be here because of having another meeting.
He forewarned me last week, I wasn't, prepared this morning, but it's,
Just want to be sure that's clear to everyone. He did not have a lack of interest in the bill, but a simple conflict.
What's that happening?
A little history on this, this clinic used to be located very close to the hospital, and they couldn't meet the health standards, to keep their present location, and they moved it far away from the hospital. Ms. Hall, is this your district? It's in Ms. Hall's district, and it's a long way from the medical district and so forth, and I think it's a good route to be away from both sides. There's bad protesters on both sides of the issue, but it's something I don't think I want my grandchildren exposed to, but I would hope that they would move it back down closer to the hospital in case there's a need for it, but anyway, so.
We have a motion on the floor, the second, all in favor of giving the bill a favorable report, say by saying aye.
Aye.
Any opposed? Bill is given a favorable report. One more bit of business, I'd like to remind the committee that we do have a meeting tomorrow at 8:30 in